Hi friends, this session it's about clearing the CPC examination with certain tricks. So if you follow these tricks, definitely you can come out with flying colors. Clearing the CPC examination, it's not a Herculean task. It's not like climbing Mount Everest or it is a rocket science, because there have been thousands and thousands of coders who have already been certified and who have already taken up these exams, right? So even clearing CPC, it is not an uphill task. So I'll tell you the techniques with which you really can follow, and please apply these, and certainly you can get at least like more than 80%, right? So the first trick is with your time management. Though the exam runs for like 5 hours and 40 minutes, most of the coders end up with lack of time. So you should understand like the maximum time that you can have is like 2.5 minutes per question. But what happens is, it's like if it's going to be a lengthy surgical documentation and if you keep reading that for hours together, suddenly you will end up with lack of time. So the first thing is like start attempting the easier questions first. So first, if you follow that, because when I took up this exam, what happened was the very first question was on the integumentary section, and that too with so much of grafting techniques like allograft, autograft, epidermal graft and all that stuff. So I was really worried, and then finally I had to quit that question and jump on the next, because I sensed that's not going to work out. So what you should do is attempt the questions which actually you have been exposed to. In the sense, if you're an E&M coder, you can start with this E&M section. If you're a surgery coder, you can start with the surgery section. So it goes with that. So that's why I say at least like 6 to 1 year, please have an experience. You have some degree of confidence in taking up this exam. So first is your time management, because only when you clear at least like 60 questions in the first half, definitely that gives you a boost. So second thing is that the elimination methodology. So you should know to eliminate the unwanted options. If you see in that 4 options, we have like A, B, C, D. So what happens is like at least you can easily rule out 2 of those options. You can eliminate 2 of those options. It's the remaining 1 and 3rd, which would be like the difficult options. So there you really have to apply a presence of mind, and that's where it comes into picture, your degree of confidence, how much you have learned during the CPC training and all that stuff. And thirdly, what I'm going to talk about, reading this documentation. So you should know where to read this documentation. What happens is when you read this a medical record, you need to know if it's going to be a lengthy one or a shorter one. You know that CPT book is actually a coded book. So it's like developing the outlines. It's not completely going to be described. So you need to look out for those keywords, whichever is there in the question and which matches the medical record. As always, we know as we medical coders, we are like translators, and our job is again to compare the medical record and the code sets. So look out for those keywords which differentiate the one CPT code from the other. And next is, while reading these medical records or these questions in that CPC examination or any other higher examinations, what needs to be considered is what is the actual examiner asking you, what is you are being tested for. Sometimes a surgical procedure has been documented, but then the question would be like, how would you report this for an anesthesiologist? So here comes a problem, because many coders would blindly assign the codes just by reading at it. Because the question actually tests the services or the AAPC code that we need to report for the anesthesiologist. In that case, the code would start with a 0. If it's been a surgical section, that should start from 1 to 6. So read the question properly. What is exactly the question that is being asked for? You need to answer that. Say for example, a patient has been consulted, maybe as an inpatient on 2 days. He's being admitted. Okay, in that case, you need to know, sometimes a question might test you, what was the service that was rendered on the subsequent date? That's all the more important. So you cannot be reporting all the services at one end. Sometimes, the question might say, report only the surgical procedures. Say for example, there could be a pathological examination or consultation service that has been rendered on that day, But then the question is actually asking for you to report only this surgical procedure. So you need to understand what the question is being centered on or being focused on. You cannot report all the services that have been rendered to this patient just because the service was rendered, but you need to know what is the exact question. So many coders fail to understand this. They keep reporting, they keep reading all those entire stuff and they tend to report all that stuff and they tend to ignore the actual question. So we have seen these three important things. First is time management, second is elimination method, and third as reading these medical records. And then parallelly, you'll have to also read the actual question that's being asked for. Then what we can do is certain shortcuts that will certainly help you is on modifiers. If you have a good understanding of modifiers, certainly you can, clear this exam easily, because you cannot be referencing each and every modifier in your HIPEX book or in your CPT book during the examination hour. What you should do is you must know all those basic modifiers. Though I am not asking you to have a deeper understanding of this entire billing modifiers or reimbursement modifiers, certain modifiers like 50, 51, 52, 53, it's like 57, 59, and you should know the difference between this global surgery modifiers. When can you apply a 58 and when is it a 78? Is it a planned surgery or is it an unplanned surgery? So that essentially differentiates the 58 and the 78 and then a 79. Again, if assistant surgeon has been asked, so is it an 80 or an 81 or an 82? So you should have a very good understanding of all these modifiers, and you should not be wasting your time looking out or reviewing the description of those modifiers. Say for example, if it's been asked for like GX or GY, at that time it is prudent that you go to your HIPEX book, because what essentially the CPC examination test is actually whether you know where things are placed. Say for example, if it is a question on anatomy, or is it a question on any pathological condition, say like ichthyosis. This question was asked during the examination. What do you mean by like ichthyosis? So no coder would have an understanding of this. But what you should do is you can directly go to the ICD-10-CM and see what ichthyosis, ichthyosis means. Then you tend to understand that is actually something to do with like fish poisoning, or like ichthyotoxins is like poisoning with fish, so something like that. So you can figure it out just by going through your ICD-10-CM, and there are so many illustrations, diagrams that are given. So if there's any particular question on anatomy, you don't have to blend. You can very well look at either the HIPEX manual or the ICD-10-CM, where the entire illustrations are being given for each of these organ systems. If you see, all the cranial nerves are also given, so you don't have to memorize. But if you know what nerve it is, it would be very easy for you to clear the exam easily. Again, with reference to these modifiers, take for instance modifier 52 and 53. 52 is for a reduced service and 53 is for a discontinued procedure. You essentially need to understand the difference with the usage of these modifiers. Now, when we are going to see this colonoscopy tree, which is under this gastrointestinal system, where we are going to use these 4 series codes for a colonoscopy, then you need to know whether you'll have to use a 52 or a 53 depending on the therapeutic services or the diagnostic services. So all these need to be taken into consideration. And again, you also need to look into those parenthetical instructions that are given underneath each of these CPT codes, because that's where you are going to be tested. So modifiers, yes, you really need to be very skilled. And I'll tell you one trick how to remember is, whenever you go to office every day, it's like take 2 modifiers, for a to and fro journey. What you can do is, when you're going to an office, take 2 modifiers and keep that in your mind, store it in your mind. 52 is for a reduced service. 53 is for a discontinued procedure. Okay, so in this way we are going to follow, definitely you can master this entire modifiers, because these are the areas where you can very well carve a niche, in the sense like you can make yourself comfortable and you don't have to spend much of your time. So again, there's a saying, sweat in peace so that you don't have to bleed in a war. So you'll have to make your equipment sharp when your time at rest. So it's like sharpen your equipments. It's like store all this information in your brain so that you can recall all of this vital information during this crucial examination time period, right? So yes, you need to be very strong with these modifiers. No excuse unless you are thorough with these modifiers, because modifier again will be a crucial criterion in like eliminating these options. So usage of unwanted modifiers. Say for instance, it's going to be an add-on code. You can't choose modifier 51. So that's going to be an incorrect option. So this way you can eliminate this option. Moving on to ICD 10CM. So I want to certainly share that most of the examinations that I took was with, it's like ICD 9CM, because ICD 9CM was way easier than ICD 10CM because we only had numericals there. We never had like alphabets except for these V codes, which we are currently saying here as Z codes. We were having like V codes. So it's like if I want to remember diabetes to report at 250.00, if it is hypertension 401.9. With this transition to ICD 10CM, we have this alphanumeric characters, and it is really difficult for us to memorize certain ICD 10CM codes. So what I would say is like, but here I too thought whether, with this onset of this ICD 10CM transitioning, I thought the question paper would be a little easier, but no, that was not compromised at all. The same questions were asked, except where the ICD 9CM codes were actually being changed to ICD 10CM. So there is no point, it's like, fretting over this, but we need to figure out a way. So what I tell you is, if you are going to talk about, ICD 10CM, it's like if you are going to ruling out with ICD 10CM, it is not heavenly possible for you to go through each and every code from this index to this tabular list. It's not possible for us to go through with the index and then to the tabular list. So what we need to do is like, I'll give a simple trick. So for that, you need to understand how each of these codes are going to start with. Say for example, A and B. So codes start with A and B codes are for infections, you all know. And if it's going to be with this COVID, we again have got this U07. So ABU is ABU, which is actually used for all these infectious conditions. Next, it is C for cancers and D for neoplasms again, because we have this benign tumors. So the codes for benign neoplasm starts with the D code. And also the hematopoietic conditions also start with a D code. Say thrombocytopenia or an eosinophilia. And then we have this E codes, which is actually for all those endocrinal and metabolic disturbances. For example, like diabetes or obesity or hyperlipidemia. So all these we can categorize under this E codes. Then when we talk about like this F codes, these are all for mental disorders, and G codes for neurological conditions, and H codes are all for the special senses, the optic and the ocular system. And we also have to see this I codes, which are actually for this cardiovascular ailments or disorders that pertain to this cardiovascular system, be it the heart or the vascular disorders. And then we have this J codes, which are for the respiratory conditions. K codes are for this gastrointestinal or the alimentary or the digestive system disorders. And L is for all the skin and subcutaneous disorders. And M is for musculoskeletal system. N is for urogenital system, and O we have for obstetrics, a pregnant woman, conditions that take place during pregnancy, parturition and childbirth, or also during this puerperium. So we have these O codes. And P for the peripartal conditions, conditions that take place after this neonatal period. And then we have this Q codes for all those congenital conditions. R for signs and symptoms. S, again, for think of this way, S for sprain and strain, which is for injury. So all these injury related disorders, say if it's going to be a case of a fracture, which is a traumatic fracture of tibia, so the code would start with S as the alphabet. And T, as we all know, it is for toxicity, which is poisoning or adverse effect of certain drugs. So the codes would start with T codes. U we have already discussed. It is for this COVID infection, and alphabets that start from V to Y is again for health related disorders. And Z you all know, like encounter codes or for screening codes, so observation codes, so all start with the Z codes. So what I say is like, so once you know the order of all of these conditions that pertain to each of these organ systems, certainly that would be helpful. Take for instance, a patient is presenting with an abdominal pain and is being diagnosed with acute appendicitis. So here what happens, we know this rule states that when a person is presenting for an ailment and for which a definitive diagnosis has been established as acute appendicitis, then we don't have to report this related symptom. So in which case you don't have to report this abdominal pain. So here we need to report only this acute appendicitis, and this acute appendicitis is an inflammation of this vermiform appendix, which is part of this gastrointestinal system. So obviously the code should start only with the K code. So if you have an option, if you are going to rule out with ICD-10-CM, look out for all those 4 options in which you have only the K code. If you have an abdominal pain code and then a K code, so that option is going to be incorrect. So with that, we can easily rule out and eliminate with the ICD-10-CM codes. To conclude, there is one more major secret which I can certainly share with you if you take up the training from Dr. Ram's Medical Coding Academy, because that was my practical experience when I appeared for all of these 33 examinations, because that helped me in a bigger way. I should tell you that. Certainly I'll let you know when you actually subscribe to Dr. Ram's Academy CPC training module. So here we are actually providing the training. It's like completely online. So a username and password will be provided to you all and you can make use of it. And here again I want to emphasize that you will have to practice these mock examination papers, because what happens is many coders I've seen, like they used to finish off all these 150 questions in a row thinking that they'll have to finish the examination quickly, and they ignore the fact that they are not giving adequate attention to those concepts there, because this is majorly we have been noticing in most of the coders, and this is really causing them to fail their examinations. What I suggest is, if you are going to write or going to take up the test for at least like 25 questions, please ensure that you understand all of those 25 questions. There is no point in taking 150 questions where 50 questions you are still not sure. That's incorrect. So make yourself comfortable. I know everybody's life has become very busy with work, and life balance is very difficult to balance. So every day if you're preparing for this, you need to at least spend certain portion of time for your preparation, at least methodically and consistently, 25 questions or 20 questions per day. And please understand, you will have to understand all of these questions. So learn those questions, and then what you have to do is, so if you're like attending like 25 questions, and if you feel like 5 questions you don't understand the concept, and if it turned out to be like erroneous ones, then you'll have to go back and see what were those erroneous questions, because definitely there might be a guideline that is hidden in those questions. So once you understand that, certainly the same pattern, a different question would occur in the same pattern in your actual examination. So if you ignore or overlook those 5 different questions, certainly that would cause a tremendous impact on your actual examination. So that's my suggestion. You will have to attend these questions methodically, understand all of these questions. It does not matter how many questions you take. And another thing is, like, if you don't find time, what one best option is, if you're working in an office, what you should do is like finish your production on time, and you can take as many online tests. Take as many online tests, and then that would certainly give you the confidence. Because when you take more and more of these mock papers, definitely you know the strategy. You will understand how to eliminate and where to eliminate. To summarize, these are the tips that I'm providing from Dr. Ram's Academy for clearing the CPC examination. So first is time management. Second is the elimination method. Third is reading the question, what is being asked and what not to report. And fourthly, it is with modifiers. Fifth, it is with this ICD-10-CM elimination method. And finally, though it is the last, it's not the least, taking the training from Dr. Ram's Medical Coding Academy. So follow all these tips and certainly you will come up with flying colors. All the best, and I'll see you in our next video. Thank you.
You can contact us at 805-60855-969962791072.